You know, strokes are serious medical emergencies that require quick treatment, and luckily, many strokes are preventable. Dr. B joins us from People's Health to share warning signs of a stroke and tips for lowering your risk. Good morning, Dr. B. I've heard you often. It's a pleasure to speak with you in person.
Yeah, you too, John. I hope you're doing well.
Doing good. First of all, let's start off and explain what exactly is a stroke.
Yeah, sure. So, a stroke can be really devastating to the patient and their families. And it's a life-threatening event that happens when the brain doesn't get enough blood flow. And without that steady supply of blood, what happens is the brain cells can start to die from the lack of oxygen. And that actually can lead to either permanent brain damage or really long-lasting health complications, especially if there's any delay in getting treatment for the stroke.
We'll get to that treatment in a minute, but what kinds of strokes are there? Are there different kinds, or are they all the same?
No, there are really two main types of stroke that we talk about. The most common type is what we call an ischemic stroke. That's about 9 in 10 stroke cases that we see. And those ischemic strokes happen when a blood vessel in the brain gets blocked or it's too narrow for the blood to flow through it. And that can often be from something like an embolism, which is a floating blood clot, or it can be related to really severe cholesterol blockage and plaques. And then the other kind of stroke is a hemorrhagic stroke. So hemorrhagic means bleeding. It happens when a blood vessel in the brain actually leaks or even bursts, and that can cause bleeding in and around the brain. And that can be from something like trauma or even really high blood pressure.
Is one more serious than the other?
They both can cause really severe complications, so it's really just the treatment that differs depending on the type of stroke.
We hear the term mini stroke. Someone had a mini stroke. What exactly is that?
Yeah, so mini stroke is something. It's actually a nickname for the medical term, which is a transient ischemic attack, or more simply, we call it a TIA. And these attacks really cause temporary stroke symptoms, so they look very much like a stroke, but there's actually no long-lasting brain damage. But they can actually be a warning sign for a full stroke to come in the future. So mini strokes are really, a serious risk of possibly having another stroke. About 1 in 3 people who have a mini stroke will go on to have a full stroke, often within about a year.
How common are strokes, and is the trend for more strokes per capita due to maybe stress and the type of fast-paced lifestyle today?
Yeah, definitely it can be. I mean, unfortunately, strokes are extremely common in the U.S., and in fact, they're the fifth most common cause of death in the United States, and they lead to a lot of long-term disability. And, the fast-paced lifestyle, like you were saying, and some other health complications that a lot of Americans have is leading to an increasing risk of stroke. And about 1 in 3 Americans have at least one major risk factor for stroke.
Wow. And what would those risk factors of a stroke be?
So really the biggest one is age. Strokes are much more common later in life. About 2/3 of them happen after age 65. And the other big risk is actually sex. So if younger men are more likely than women to have a stroke, but because women tend to live longer, they have actually a larger lifetime risk of stroke. And women are actually more likely to have a fatal stroke. So the other things we look for is personal or a family medical history, because that really affects your risk as well. So if you've had a stroke, you're about 4 times more likely to have another one later in your life. And if you've got a close relative, mom, dad, brother, or sister who's had a stroke, you're more likely to have one as well.
Well, if it's in the DNA, there's not much you can change there, but what can you do to change the risk factors?
Yeah, there's a lot of controllable risk factors, so things that we can change. And some of the biggest ones are very similar to the risk factors for other chronic diseases. So not being physically active and being overweight is a major risk factor that we can control. Our diet is huge. Eating a poor diet can lead to a higher risk of stroke. And then really one of the biggest ones is smoking cigarettes. That absolutely increases your risk for stroke. And then there are certain medical conditions as well, in particular people with high blood pressure, high cholesterol, or diabetes have an increased risk. And you can imagine there's a lot of people that have all three, so it's compounded. So you really want to make sure you manage those chronic medical conditions to lower your risk of stroke and work with your doctor on doing that.
All right, Dr. B, I got a couple of questions coming in on our text line. Also want to talk about the signs of a stroke and how they can be prevented. Stay with me. We're going to take a quick traffic break, and we'll be right back. If you happen to have a question for Dr. B, let us know. Use our Oakland Heart Jewelers talk and text line 504-260-1870. I'll be glad to pass it along. Right now, let's take a look at traffic. We'll take you to our WWL Traffic Center for Courtney P. Okay, here's the situation. It's a hot, muggy, and sometimes rainy today, Thursday morning, along the Great Gulf Coast. I'm Don Dubuque in for Tommy Tucker, and we're here on WWL where the doctor is in. Dr. Brent Wallis is with us, and we're talking about strokes. Dr. B, what are the signs of a stroke? And I guess this is important if you notice these signs in someone that is in close proximity to you as much as it is yourself, because someone experiencing a stroke may not be able to recognize that because they are impaired. What do you look for in either yourself or in someone else to identify a stroke is happening?
Yeah, exactly what you said, Donna. This is really what you should be looking for usually in your loved one. A lot of times patients will present with a really severe headache. Sometimes they say it's the worst headache of their life. They may have trouble walking or even just balancing when they're standing up. And then often they will have numbness, and it can be really anywhere on the arms or legs or even the face, but it often is only on one side. That's a real telltale signal. And then they can have vision changes, sometimes even sudden blindness or maybe double vision. And a lot of people will develop trouble speaking or even understanding others. And so what's so important is to remember that stroke is a life-threatening emergency, and every second counts. And so if you notice any of these symptoms in a loved one, you want to call 911 right away, because getting that quick treatment can prevent a lot of these long-term complications and increase the risk of survival. And I always say, everyone knows how important it is to react to a heart attack. Stroke should be considered a brain attack, because that's exactly what it is.
So if you see these symptoms, maybe one or even more occurring, is there any first aid on the scene action that an individual can take before getting them to a medical facility?
Yeah, there really isn't, unfortunately. It's not like a heart attack where you take an aspirin, because if you have a bleeding stroke, you don't want to take that aspirin. So really, best thing to do is just kind of protect their airway, make sure they're able to breathe and swallow normally, and then call 911.
So let's say we talked about the mini stroke. If someone has a mini stroke and perhaps they don't identify it as such, does it leave a trail? Is there a way that a physician can identify if someone has had a stroke?
No, usually radiologically, so with X-ray and stuff, you can't always see the signs of a TIA or a mini stroke, and so we have to rely on history, either from the patient or from someone who lives with the patient, that something like that occurred. But they do go unrecognized quite often. And
what complications can develop?
Yeah, so after you've had a stroke, it's not uncommon for people to develop pretty severe depression, likely due to the disability, but because of some other effects that strokes have in the brain. They can also cause a lot of long-lasting pain, and in particular paralysis or limited mobility, like I said, often on one side of the body. And then people that have a real severe stroke can have trouble talking or swallowing, and they can have memory loss as well. And what really determines what the long-term complications are how long the brain goes without oxygen, which is why 911 is so important, and then which part of the brain is affected.
How can someone prevent a stroke, particularly someone who may have some of these risk factors?
Yeah, I mean, the great thing is most strokes actually are preventable, and one of the best things you can do to lower your risk is really, create some healthy habits. It's just like we say with all chronic medical problems, exercising regularly is critical, and that should be about 30 minutes a day, 5 days a week. You want to talk to your doctor about creating that exercise plan in case you have other medical conditions, but that is one of the best ways to lower your risk.
You talked about healthy eating. It's a risk factor if you're eating a poor diet. What is a good diet?
Yeah, so what you want to do to have a really good, nutritious diet is you want to make sure you're including things like whole grains, plenty of fruits and vegetables. You want to go with low-fat dairy products and really limit your saturated fats in general. Lean proteins are going to be much better than those fatty proteins, things like beans, grilled chicken, salmon. Actually, most fish is actually very good for you. And you really want to limit your salt intake because salt tends to raise blood pressure, and that's one of the biggest risk factors for stroke.
Anything else you can do to prevent a stroke?
Yeah, probably the number one takeaway is stop smoking cigarettes. Cigarettes raise your blood pressure and they cause direct damage to your heart and to those blood vessels in your brain, and so they tremendously increase your risk for stroke. So if you are smoking right now, you want to get with your doctor and figure out what resources there are for you to quit. That's going to be your best bet.
That's some very good information, Dr. B. How can people find out more about people's health?
Yeah, they can always come by and see us at the Medicare Center in Metairie that's right next to Party City. You can make an appointment to come in and talk to us or just walk in. We've got all this information and more, and we host a lot of educational programs like this as well.
And there are a lot of educational programs right here on WWL. Thanks for being with us, Dr. B. We appreciate it.
Thanks, Don. Have a great weekend.
All righty. That is Dr. Brent Wallis, and we'll be back right after the news. Here it is, WWL's First News.